People ask, oh, what's root planing? Yeah, we smooth the roots of your teeth so that the gums can then reattach and become healthy again. What pockets are are where bacteria can grow and develop, and once we get other pockets, it's a tighter fit of the gums to the teeth.
All right, here we are back with Dr. Michael Kali from Santa Barbara in California. Dr. Kali, you're doing a lots of things and you're using a lots of very new equipment. Let's talk about laser. And laser, you said something about cleaning with laser. What's the difference between old style cleaning, laser cleaning? What's the advantage? Tell us about it.
Yeah, we provide dental cleanings at our office with laser assisted. So we have found that traditional scaling or root planing can get a lot of patients healthier, but some patients have a type of bacteria that is killed by the laser quicker than standard dental procedures or dental cleanings. So some patients that have periodontal disease need more extensive dental cleanings, and we want to stop a recession. We want to stop gum disease. We want to stop the bacteria, and we can do this with laser treatment. So the newest technology for doing what's called scaling or root planing or gum disease treatment uses lasers to sterilize the pockets after cleaning. We still do the cleaning part, but the laser, that's why it's laser assisted. The laser kills the bacteria that's in those pockets. It also helps the gums to heal quicker. We found that the healing phase for after gum treatments is actually a lot quicker and less bleeding when we use the laser assisted treatment.
All right. So, okay. So from what I'm getting here is that the laser, one of its main thing, and you tell me whether that's the only purpose, is to kill the bacteria in it, which makes a lots of sense because if you can kill bacteria fast and without a lots of medicine and all kinds of things, that would be good because infections are infections, and that is basically getting the infections rate down from having a baby and all is what extended our lifetime pretty much the most, I think, in the whole last couple hundred years. But
Yeah.
so I can see that part. And then you said something by cleaning, you still need to do the cleaning. By that, did you mean you still need to kind of chisel off the plaque, the
So
way?
yeah, we still use our ultrasonic scaling instruments. We use the hand scaling. We do both of those, and that gets the calculus and tartar off the teeth. So that's very important too. But then the enhancement that we can provide in my office is the laser also kills the bacteria. So that's the main purpose in the lasers, to kill the bacteria.
And by doing so, the gum will reside, the gums will grow better, faster, and not kind of retract as easy as they would otherwise. Yes or no?
Yes, they heal much faster. Anytime you have gum disease, you are at risk for recession and losing gums and bone. So our goal is to stop that in its path. Occasionally, people also need gum grafting, so you can have some recession even after gum treatment, whether it's a laser or the traditional method. Um, but as far as stopping in its tracks and preventing future recession, we that's where we provide the laser treatment.
Great. Wonderful. And since the healing is going a lot faster, what you said, is the treatment in itself also speeded up a little bit? Because nobody really loves to sit in the dental chair if he doesn't have to for too long.
So we have some of the newest technology with the ultrasonic scalers. We have a ultrasonic scaler that has a light on the end of it, and that allows the dental hygienist to see and be able to provide the scan and root planning quicker. I wouldn't say the laser in itself speeds up the dental cleanings, but having the newest technology, including the newest ultrasonic devices, I would say that helps speed up the cleanings.
You said a couple of times the word root planning. Can you kind of tell me, tell the listeners exactly what that is, like you would explain it to a 5-year-old?
Yeah.
Because
So
it's not a root canal, so I'm a little, uh,
yeah.
tell me.
Yeah. So when we do a deep cleaning, another name for scaling and replaning is deep cleaning. Another name for it is non-surgical gum treatment. So our goal in scaling and replaning is to prevent patients from needing surgery. So if people come to us soon enough, we can prevent their needing to have gum surgery by doing non-surgical gum treatment or scaling and replaning. And it uses different instruments. Uh, we use the laser. It's different than a regular cleaning. So I sometimes don't use the word deep cleaning because it's completely different. We actually use different instruments. We go deeper under the gums. The patient's numb, so that's nice. I tell patients you'll be numb when that procedure's done. You won't feel anything. Um, and we'll go under scaling is removing the deposits, the tartar, the calculus, and then sometimes the bacteria have made the surface of the tooth rough. Bacteria have even gotten into the first layer of the tooth. So what we do is do the root planing. People ask, "Oh, what's root planing?" Yeah, we smooth the roots of your teeth so that the gums can then reattach and become healthy again. What pockets are are uh, are where bacteria can grow and develop. And once we get other pockets, it's a tighter fit of the gums to the teeth.
All right. So basically, all of them, and let's be really layman here, because that's important for us laymen. All of it is actually the same. It just depends how much garbage, how much infections are in the tooth and between the tooth and the gum, and how deep does it go. If you as deep as you go, as more you call it from a cleaning, you call it a deep scale cleaning, you call it a periodontal surgery, kind of like full blown. And when you say root planning, you're basically just grinding down the area of the meat slash tooth near the root where all this infection was there to get it all out, right?
That's correct. Yeah, there's different levels: slight, moderate, and severe. People
Okay.
can have different disease based on how deep their pockets are and how long they've gone without having their teeth cleaned.